I keep calling him my unicorn because I have never met in 25 years of practice an orthopedic surgeon that cares so much about the outcome, the prehab, the rehab, the process. Every hospital should follow every patient it treats long enough to determine whether the treatment was successful and to inquire, if not, why not?
Empowering the patient and setting in their mind the idea that they are participating in and expecting a good outcome.
My whole mantra, I am safe, movement feels good, I am strong. As they were wheeling somebody out in a wheelchair, putting them in the car, I jumped on them with the stickies. You do what you can, right?
The challenge with any scarring in the lung is you can't put tissue back that's not there.
My favorite tagline is, it's hard to believe until it's hard to ignore.
Thank you for subscribing to the Frequency Specific Microcurrent podcast. FSM is a breakthrough tool for medical practitioners who feel stuck with limited treatment options, especially for complex issues unresponsive to conventional care. FSM training is the best continuing education course for medical practitioners. Get our free introductory webinar at frequencyspecific.com/about or find FSM trained practitioners at frequencyspecific.com/find. Here's Dr. Carolyn Kim Pittis.
I feel like so much has happened in such a short period of time. It's been such a busy, exciting, fantastic week.
Truly. Tell me your story.
Some people know I have transitioned. I've opened up an additional location.
Oh, that's right. Oh, you
very-
did the podcast with Dr. Massey.
We did on the weekend.
awesome.
So that should be up in a couple weeks or so. Here's the funny thing. So he's got a really great studio. He's got like an in-person Kevin that's there doing all that. I think you saw the video I sent you.
Yeah, I was so
Stuff.
jealous.
And we got there and we started talking, and then we're like, hey, wait, let's just wait till we start rolling, just in case this was like good material. Because we started talking about the shoulder and frozen shoulder and all these things. And so we're talking very much the back and forth, very similar to you and I. And then he starts wrapping things up. You could tell he's trying to close the show. And then that was quite a bit for 2 hours. I'm like, wait, that was 2 hours? And the producer was like, yeah, you guys hit flow state at minute 6. So
You got what?
we hit flow state by minute 6. We were just so excited, and it was an unreal 2 hours. So it takes a bit to edit
Insane.
something. Yes.
Yeah.
Yes.
Gee, I would wonder what that would feel like.
And now I have 2 people. I keep calling him my unicorn because I have never met in 25 years of practice an orthopedic surgeon that cares so much about the outcome, the prehab, the rehab, the process.
Not only cares about, but understands that it's a thing.
Right.
It's the guy that did my hips
Yeah.
was like that. But to find a surgeon of any sort that understands that whole process
Yes.
and then cares about it. Understanding it is one thing,
Yes.
caring about it,
Yes.
he is a very special person. Lucky us, lucky you.
Lucky all of us, right? Lucky world that there's somebody like that exists. His clinic is beautiful. His staff is fantastic. His patients even more exciting.
Wow.
Time, I think our hour is like a vortex. My Thursdays at that clinic, I've been in on Mondays also. They can't, I'm like, I'm back. I'm here again. It's just,
So is it just one day a week?
right now, I thought I would just do one day, but I've been also coming in on Mondays. I had the privilege of doing an in-service for his staff on Monday. Then there was another doctor that was there who threw me for a loop. I'm like, oh, okay, I've got to use the big girl words and explain some things a bit more clearly. It was great. It was very well received. I'm learning a lot. It feeds every little part of my being, actually. It's very exciting.
Oh.
Yeah.
Yeah.
One thing that I wanted to say before we go any further, so I had brought my favorite book to my podcast with Dr. Massey. This is the shoulder book with Dr. Codman, second edition, that I was gifted. And
wow.
when I did the frozen shoulder talk a couple years ago at the Advanced, I was I wanted to include my whole idea was just to include some pictures of Dr. Codman's like the Codman exercises that we love. And then of course the internet being the internet, I went down the Dr. Codman rabbit hole and I started reading some of his descriptions of surgery. And that's how we went from the adhesive capsulitis to capsule contracture. And hearing a doctor from the 20s and the 30s use the words that a lot of the frequencies I think are derived from. He uses words like hemorrhage. He uses words like, what's another one that he uses that seem very almost dramatic? And you're just like, it's not hemorrhaging, but that was his, it was bleeding in areas that it shouldn't have been. And
Yeah.
so I'd sat down I just open up a page once in a while and it's like a love story. It's not a surgical book. It's fantastic.
It's
But
like a novel.
I don't know that we credit Dr. Codman with the end result philosophy that doctors and hospitals have. And that was his baby. He was talking about the importance of tracking patient outcome. And there is just something that I wanted to briefly say, because I think this might spark something. At the turn of the century, Codman conceived the end result idea, which was, in quotes, merely the common sense notion that every hospital should follow every patient it treats long enough to determine whether the treatment was successful and to inquire, if not, why not? And I think that is, again, simplistic, but that's like us. When we see patients and we think about their quote unquote failures, if not, why not?
Yeah. And that the MDs that I called on as a pharmaceutical rep for 16 years were trained not in the 20s, but in the 40s and 50s and 60s. And that philosophy was a thread through medicine up until 1984, 85, when managed care became a thing.
Right.
And evidence-based medicine was introduced by the pharmaceutical companies as a way of keeping anything except pharmaceuticals out of medicine, because who else can afford to do blinded trials? And it's something that permeates me. It's how I was trained. And that's what we do. One of the things that bothers me at this point is I don't have patients that come twice a week for 4 to 6 weeks and then can book a month out, 2 months out. I see people for 4 days and then I keep track long by email, which
Right.
doesn't count. But the fact that Dr. Reynolds shares that philosophy as a foundation for his practice, and you two, us three, we all share that as a common thread for patient care.
Yeah.
Care about the outcome and
Yeah.
follow it, especially post-operatively.
Yeah, he had asked on the podcast, and we'll link it as soon as it's up because I think it's going to be so great. But he had asked, where do you think the gaps are perioperatively? And you had just mentioned post-op, but I might humbly and respectfully disagree with the post-op. I see with a lot of patients and athletes waiting for surgery, they're just left. Sometimes the surgery is delayed because of the surgeon's schedule. Sometimes there's a reason. Maybe we need more extension in the knee before we want to do the ACL repair. There's all these different reasons why surgery doesn't happen yesterday. But to think, okay, what is the best outcome here? So if it's an ACL, where's the graft coming from? Can we make the harvest site healthier? Can we strengthen the opposite leg, the knee, the hip? There's just so much we can do.
Well, and once you do the ACL, what muscles need to be strengthened
Right.
before before. So
Exactly.
the thing that New Heights did with me before my neck surgery, we did 6 months of prehab.
Right.
And then once I blew it, we did a month and a half of prehab. And
Right.
then we did 6 months of rehab before my hip,
Right.
9 months of prehab, strengthening the muscles around the hip so that when they replaced it, it would be as functional as it could be. Same
Right.
thing with the other hip. It was just,
Yeah.
it makes total sense. And nobody
Right.
does it except
Us.
us, I guess.
At the very least, if I can get somebody to sleep at night, let's just say all the exercises and all the manual therapy go to waste. If I can help somebody get a better night's sleep in the weeks leading up to surgery, that's already a gift. If you can help them digest their food a little bit better, bring their stress levels down, feel like they're connected and they're not just abandoned. And also in the post-operative phase, there are also phases where maybe it's not right after PT, you don't have PT right after you're left, there's pain. Can you do something? Can you not? There are a lot of gaps that I think can be filled in with us.
And speaking of preoperative, patients who are headed to surgery feel like victims.
Exactly.
So they are powerless, waiting for the mighty surgeon to come in and do his thing.
Right.
You can explain sleep means growth hormone.
Right.
You get the most deep sleep and the most growth hormone between 9 o'clock at night and 1 or 2 o'clock in the morning. So the TV goes off, screens go off at 8, but my favorite show is at 9. Your surgery is in 4 weeks. What's your priority?
Right.
Okay, fine. No screens, in bed by 9, asleep by 10, and then we can do concussion in Vegas, we can do sleep, you can do whatever. And then vitamin C is a precursor to connective tissue.
Mm.
Okay, so you take 3 grams. If you're a hamster, you would make 1 gram of vitamin C. You're a big hamster. So let's take 3 grams of vitamin C. That's a lot of pills. No, it's not, because you have these, so you don't make vitamin C. So you all just eat oranges. No, that's 60 milligrams of vitamin C. That doesn't count. Vitamin C, this for protein. And there are some other naturopathic things to do preoperatively besides increasing protein so that you can have the amino acids to make connective tissue, vitamin C. There was one other thing, but anyway, and that empowering the patient and setting in their mind the idea that they are participating in and expecting a good outcome.
Right.
And I agree with you completely.
Yeah.
And we can help that with FSM. It's like
Yeah.
concussion in Vegas and the frequencies for fear,
Yeah.
over concern, worry,
Yeah.
anger, and resentment, because if it wasn't for X, Y, or Z, I wouldn't need this.
Right.
And then, yeah,
Yeah.
good
Yeah.
idea.
Yeah.
I never
Um,
thought of it that way, but yeah, we definitely do.
I think with me working with athletes, I think that's what made me see with a lot of lay people or quote unquote normal people the gaps, because these athletes are inundated with their team and their people at every kind of stretch. And I was working with somebody who was like on the fence about getting a hip replacement and saw one surgeon that said yes. And I said, go get other opinions. This is your right as a patient to see. And we talk about the number three quite a bit. Three opinions seem to be what I like to gather. That way you can see, go with the odds. That way you're not split. And it was decided that she needed one. And I think it was probably about 6 months from, okay, I need one to booking it because you have to get things in place for home care and work and kids and all the stuff. And she's like, I guess I just wait. And I'm like, no, we have so much work to do. Just wait, what? I'm like, we have to get you your own custom care. We have to get your exercises dialed in now so that when you do them after, your nervous system is like, oh, I've done this. This is good. These feel great. These feel safe. Movement is good. My whole mantra, I am safe. Movement feels good. I am strong. And she came back to see me yesterday, and it is 8 weeks post-op, and she comes waltzing through the door, sauntering, effortless, stride, glide. Like it was, I was so excited. I was like, yeah, just, yeah. I'm like that's, yeah, yes, win for us and win for recovery. And part of it, she felt very grateful to have that tool. She had rented a custom care in the past. She knew the importance of it, managing her pain. And so we talk about that locus of control. So in those really vulnerable days after surgery where maybe you're on medication, pain, disoriented, to have that piece of equipment, that tool that makes you feel better, the most simplistic terms, I think is it is so validating in so many different ways.
And there really ought to be a someplace, a patient's guide to
Yeah,
post-op hip,
yeah,
post-op abdomen, post-op heart. I've had those surgeries.
right.
And post-op hip, you put a full electric bed with an orthopedic trapezius hand holder gadget that goes up and down so that you can get in and out of bed without flexing your hip.
Mm,
Because these days they do hip replacements as a day surgery.
yeah,
When I had mine done, I can't remember when that was. It was 2008. When I had mine done, I was in the hospital for 2 or 3 days. Part of that was because Dr. Hex was that way, but
yeah,
that's also what it was. So the PTs taught me how to get in and out of bed. The OTs taught me how to put my socks on, how
right.
to put my pants on, how to go to the bathroom, how to
Yeah,
get up. That's the other thing. With a hip replacement, you need raised toilet seats so you don't have to bend your hip to 90 degrees because you're not allowed. You need handlebars to lift yourself up. Open heart surgery. Nobody tells people this is how you get a full electric bed. You put it in your living room and you sit, you raise it all the way up. You sit on the edge of the bed, you swing yourself into bed, and then you lay the bed down because you cannot use your abdominal muscles or your chest muscles without a consequence. So I don't know where to put that kind of information. Maybe it's out there on the internet, but it's the best part about having my medical history, which is a thing.
yeah,
And then adding FSM to that was the other thing. I had written consent to use FSM within 4 hours of the time of surgery in the hospital from the surgeon. With the day surgery, it's not quite so big a deal. But even when they did my neck, the neck surgeon gave permission. So I woke up in PACU with George putting sticky pads and the nurse trying to figure out where to put the others. It was hilarious.
I love that. Yeah. I've been lucky with my kids as the mom. Sometimes they let you come in before the kids wake up so that when kids wake up, mom is there. And I'm there with my electrodes and the custom care. And it's not always like that. There are some scenarios where they don't want you to put anything on in the hospital. We had that at one of the bigger hospitals here in California, didn't want it. And so As soon as they were wheeling somebody out in a wheelchair, putting them in the car, I jumped on them with the stickies. You do what you can, right? And I think it all comes down to just get it on as soon as you can.
And the other thing I found out when George had his hip surgery was he was on continuous cardiac monitoring because he had left bundle branch block and he went into AFib. But the magnetic converter didn't cause any disruption to the EKG. And much to my surprise, I didn't have the surgeon's permission because it was all emergency.
Yeah.
I just put the magnetic pucks around his hip. We'd
Yeah.
already treated him for the fracture, so he didn't even bruise.
Right.
So had the pucks on his hip post-op, and the nurse came in and she said, "What's that?" I said, "Oh, it's a pulse EMF." Oh, she said, "Oh, that's good. That's good for pain."
Yeah.
It's there. It's in the literature. They know it if you know what to call it.
Exactly. It was cute. I was stocking up at Costco the other day and I grabbed a bunch of 9 volts, obviously, for the clinic. Because I like to make a little nice bundle package when I give a custom care to somebody. So I have stacks of them everywhere. And the guy checking me out, he's like, I know what you do for a living. I'm like, thinking I had my FSM shirt on. I was dressed in civilian clothes. I'm like, you do? He's like, yep, you're a smoke detector technician. And I was like, what? And I'm like, oh, yeah, all the batteries. I'm like, yeah, very close. And I just left it at that because I
Yeah,
didn't want to get into it.
that's
Smoke
hilarious.
detector technician. I thought that was great. We have a few questions already that I'd like to kind of get to because I think it's important. A client exposed to TB in 1987, latent encapsulated, routinely monitored to avoid activating TB. Client main complaint, bone on bone bilateral knee pain. The plan was 124 basics, 91, 217 on
Where are you seeing these questions? I cannot find them.
like question and answer.
I don't, Kevin. I don't have that in my thing here.
Okay, I'll
There it is. I got it. Okay,
okay. You're gonna read along with me. Okay, so we got
got
bone
it.
on bone knee pain. She has a plan of attack. They were also diagnosed with supraventricular tachycardia 3 months ago. There was to do concussion and vagus and heart health. They donated their left kidney 15 years ago. Their plan was to do kidney support. Question one, any reports of activating TB by using frequency?
No, the only time I've ever used the TB frequency at all, one way or the other, was to in somebody with chronic asthma
Okay.
and bone on bone bilateral knee pain. Yeah, 42 should not do anything. SVT, concussion in Vegas, or just vagal tone.
I'm gonna
Donate.
jump in on the bone on bone bilateral knee pain. 49,
Thank
157
you.
should be in there. Vitality would be
And
where I would,
80,
and
81 and
81.
157. We
Yeah,
actually now
increases
have
secretions. Yeah.
2 published papers. David Murphy and Muiz both have published papers on increasing cartilage thickness by 2 or 3 millimeters in a
Yeah.
bone on bone. The
Yeah.
other thing that I'd like to just put a word in is when you take an x-ray, it's really easy to get the angle of the x-ray beam in such a way that it looks as if it's bone on bone. The only way to tell how much cartilage there is in the knee is an MRI,
Yeah.
as far as I'm concerned,
Yeah.
because they show the knee being bone on bone, at least on one side, but not the other. Does that mean the knee was not properly positioned? Does that mean the knee couldn't be straightened? Does that mean that they had the beam? It's close enough. Doesn't take much for it to
Right.
look as so. MRI
And you would
first.
and you would also want to see the health of the meniscus too, because if the meniscus is got some degeneration or if it's got like the micro tears, it positions everything, like you said, differently. So one side may look bone on bone, and it's because there's a meniscus issue. So an MRI would definitely be giving you more information on that. Okay, and then she's like contraindicated frequencies. She's assuming to avoid 40 and substitute with 82.
No, I know it's on the list for subacute inflammation or abdominal inflammation. I've don't know about anybody else, but I've never found it to be good for anything.
Me neither.
40, no, just use 40, but concussion in vagus, you want to increase secretions in the vagus for sure.
Yeah.
Heart health, reduce inflammation. What's interesting is the electrical system in the heart is not something that we have frequencies for. They're nerves, but they're autonomic, electrical, definitely. So when somebody has left or right bundle branch block, I'm out. It's
Yeah.
like, that's for you and your cardiologist, and I'll be happy to treat you after your pacemaker.
Yeah.
That would be just fine.
Right.
Scarring, yeah. Okay, wait. Scarring, so scarring frequency is safe. The thing with tuberculosis, if there are little spots in the lungs from the old TB, okay, wait. Latent encapsulated, okay. Latent encapsulated, so tuberculosis forms encapsulations, and that's the whole 42 constitutional type, and 42 and what's the other one? 58? 42 and 58. The encapsulation is not encapsulating the bug. It
Right.
is what the bug does, as far as I know. Somebody go look this up. As far as I know, it's what the bug does to not only the lung. Tuberculosis attacks the gut, the spinal cord, the dura. It does all sorts of things. Just because the patient was exposed to TB, has scarring from TB, we can assume that somebody has treated them for active TB, right? One would hope. So there's no reason to avoid 40 as far as I can tell, right? But just let me know if I wander off the chalks here. 681 is encapsulation. That's useful sometimes. The challenge with any scarring in the lung is you can't put tissue back that's not there, and the alveoli are really thin.
Yeah.
And
Okay.
oh, that's it. It was 42 and 87. I knew there was an 87 in there someplace.
Right.
Yeah. The thing is, they wouldn't have gotten tuberculosis if they didn't have the constitutional type. That's the homeopathic theory. They wouldn't have had TB unless they had that. So you can do a drive-by
Yeah.
on 42 and 87 and just 00 and channel B and see what happens. It can't hurt. I'd help. If it goes smush, great. If it doesn't, you're doing a drive-by.
Right.
Yeah. And I've never found any success in treating scarring in the lung, in the alveoli or whatever. Scarring in the bronchi works great. Take a deep breath, expand it, dissolve the lung tissue. But once the alveoli are scarred together, it has never helped, I'm afraid.
Right.
So there we go.
Good. Okay. And then,
Like,
so not to be remiss, are there any recommended FSM support protocols for latent TB? Did we go through that already? Or leave well
yeah,
enough
just
alone?
42 and 87.
Yeah. Okay.
Maybe drive by.
Okay, next one. Postpartum care for EDS, grade 3 tear due to EDS, vacuum assisted first child, beyond EDS support, and 124 on everything. Question number
Girl.
one, is 18 in MB acute soft tissue injury, MB wound healing okay?
What does MB mean?
I don't know. Mode bank, maybe?
Oh, mode bank. Okay, wound healing. Yeah, absolutely.
Okay.
Wound healing would not yeah, you want to stop the bleeding.
Yeah, the
It-
question was do not want to interfere with normal postpartum healing process. I don't see anything in those frequencies that would.
yeah, wound healing, part of the traditional medical view of wound healing is it's supposed to bleed. ATP is supposed to go down. That's how wounds heal. They
Yeah.
bleed. That causes fibrosis and scarring, and ATP goes down. And when I had a conversation with a gentleman whose whole career was wound healing research, I said, there's this thing. We reduce inflammation, we stop the bleeding, and we increase ATP by 500%, and the wounds heal in half the time. And he just looked at me and I don't believe it. But here's a picture. And it just, that's part of the reason we need more research. Breast milk is
Oh, yeah.
81/500. John Cale actually presented on that at the advanced one time. It was amazing. Yeah, yep, that's, you got it. Good job.
Yeah, and then she written, obviously wants to avoid scarring frequencies. Yes. So their whole body after we have a baby is like one giant acute injury.
Yes, yes. And it's one giant 124 event
Yeah.
until the elastin goes back. Is that the hormone that goes up? What's the hormone that goes up that makes everything all wiggly?
I think it's elastin, right? That makes
Uh,
everything pliable. Yeah. And then that, yeah, I was going to say something cute, and then everything goes back to normal when they go off to college, but that's not even true because
no,
things are
never.
just unorganized, or they're not, I don't say unorganized, they're just differently organized forever and ever after you grow a baby.
Yeah. And Ehlers-Danlos patients who are pregnant and who give birth are at particular risk for all
Or-
sorts of things.
Yeah. Yeah.
So good luck with that.
Yeah. Third question so far wants to know your source for topical melatonin in DSMO and emu oil.
The doctor who prescribed it for me.
Okay.
That's it. And then the compounding pharmacist that filled it, who said, "Oh yeah, emu oil is a well-known anti-inflammatory.
Right.
DMSO just is an anti-inflammatory and transdermal.
Right.
And then the topical melatonin, there are papers. There's a paper published on 100 milligrams topical. My dose is a little higher for some reason. And so once the pharmacist said 100 milligrams is standard, and okay, so I'll just use half of what has been prescribed. So that's okay. And it is an anti-inflammatory, anti-cancer. That's melatonin. There is a reason, and it was prescribed for me because of the autoimmune thing. And there is a reason that the lowest incidence of autoimmune disease is at the equator worldwide. Look up MS, look at the distribution of MS, non-existent at the equator.
Wow.
More and more common, or incidence, prevalence, that's the word,
Right.
as you get closer to the northern latitudes and the far southern latitudes. So it's almost unheard of in, let's say, Australia, close to the equator, and it's pretty common in the very south part, which is fascinating.
It is.
Who
I
knew?
mean, I knew the sun was so important.
Yeah,
When I was doing my in-service on Monday, and as going into a new clinic with practitioners that have never heard of FSM is so exciting because They're like, tell me what it does. And I'm like, how much time do you have? Because this is not a passing in the hallway kind of thing. You could maybe explain what a laser does, right? There's just so many different facets to it. And so we have a young clinic and somebody was asking, it just if it was invented so long ago, so it's not really new. And I'm like, no, it's not really new. It's like, why didn't it become more popular? That's probably one of the biggest questions I get with patients as well. It's like, how come it's not everywhere? And when you think about that time, it's in the first few slides of the core, and you talk about the Flexner report and all these things like homeopathies that went to the dark basements and were not used. When you think about just the very basic things like a good diet, sleep, sunshine, there is no money in the, you cannot prescribe these things. Nobody profits from these things. And I don't want to sound like a conspiracy theorist, but when you say things like around the equator and we think of the blue zones in the world and all these different things with meta-analysis, like these numbers just don't lie. It's really hard to ignore that type of thing.
And if you take, when they ask if FSM is so good, why isn't it more widely used? I don't go back to Flexner. I go back to, I got this list in 1995. I started using it in 95 and 96. I started teaching it in 97. And it works so well that we started publishing papers and making presentations in 98. And we now have 23 published papers, a medical textbook published by Elsevier, The Resonance Effect, which is a consumer book. And we're, number one, we're talking about a profession that took 50 years to learn to wash its hands. There's that. So the medical profession is very conservative when it comes to taking on something new. And FSM has always spread best by word of mouth.
Yeah.
Because it does things that are hard to believe until you feel them and see them. And then that's how it spreads. When something has to spread that way, and it doesn't have a pharmaceutical rep, we don't have a sales rep going around. Everybody wants it to be about the machine. Oh, yeah, I have this machine that does this. How nice for you. I don't have, there are machines, but that's not the thing. The thing is training the practitioner to think when they have frequencies as a tool. And that is an education process that takes years. And then they get
And
better.
it never ends.
It just doesn't. And
I think my favorite tagline is it's hard to believe until it's hard to ignore.
oh, I like that. That's, yes, it's hard to believe until it's impossible to ignore.
Impossible to ignore it. And
Yeah, hard to ignore.
I feel like that's what our results are. You use the phrase reproducible all the time. And yeah, it would be really great if the treatment was tied to me in the pretty room with the fluffy blanket and the warm towel until you program what you've done in the clinic on the custom care and it's reproduced at home on their couch that night. The pain goes down, the swelling goes down, they get sleepy, they have a, that's what I mean about being like, it's hard to believe until it's hard to ignore it.
And the thing that honestly, the thing that saves us and the thing that is wonderful. So I went to the quantum biology forum where they're talking about all of this esoteric stuff. And the thing that saves us is the cytokine data and the mouse research.
Yeah.
When 40 hertz reduces inflammation better than any medication ever, faster than any medication ever. If that was the only data we had, then you up the burn healing slides, and then you put up the scar tissue slides. And then you'd put up the delayed onset muscle soreness slides. And then, so there's what data we have. How do you get a p-value with 3 zeros and a 2 with 22 patients? Anybody that knows statistics, it was really fun doing that lecture with PhDs in the room. They know what a p-value is. And that's an N of 22. And actually the DOMS paper is 2 zeros and a 2 or a 6, but it's with 22 patients. That's not possible.
Yeah.
And just the look on their face was that just, huh? What? How? Okay. And then Juliana Mortensen is in the process of writing an article and shared with me, she's been feeding Grok, her chat GPT buddy,
Yeah.
her AI buddy, all the information going back to forever about everything from Abrams up through FSM. And the article that she's going to write is she's ready to take on the FDA. It's okay. I'd rather not poke the bear quite yet. But she said it is evident, it is practice-based medicine as opposed to evidence-based medicine. And we have both, really.
Yeah.
So that's pretty cool.
One advantage I think I've had in the sports side of it is that if you are doing something that is evidence-based, that has the double-blind, peer-reviewed study from 10 years ago, it's essentially obsolete. Sports performance, sports therapy moves so fast. And I feel it is mostly practice-based, team-based, individual-based. We have an example of it now spreading across multiple sports from the NFL, the NHL. Now we have the NBA, multiple teams in the NBA, multiple teams in the MLB. And it just takes one athlete to have one custom care, to have one outstanding season for the team to be like, okay, what's that little blue box you got?
Yeah. And that's somebody said, well, how did you get involved in sports? These patients see Kim and one of them gets a custom care and everybody notices he's using it on the plane or on the bus on the way home. And the next day he's not sore. So then 2 or 3 of his best buds will say, what are you doing? And then those guys go to see Kim. And when the top 10 players on the team all have these little blue boxes, pretty soon the team trainer goes to them and says, okay, what are you guys doing? And
I give
then
up.
the team trainer calls Kim, and that's how it spreads.
Yeah.
What did you say? It's hard to believe until it's impossible to ignore.
Yeah.
Hard
Yeah.
to ignore.
Yeah. Yeah. And you have to be, I feel like I just believe so strongly in it. I've seen it work too well over all the years that I feel like I can dig my heels into the sand and say, this is what we're doing. And it's great when, again, those results are reproducible. So somebody like Dr. Reynolds can say, okay, uncle, I give up. Let's get this on everybody perioperatively because it works. Let's not even give them an option. Let's just say, this is your device and this is what you're doing. People are so quick to throw those like ice machines on them.
Oh,
And
God.
and yeah, they feel great, right? I'll never argue with somebody that putting ice on something feels good. That is hard to ignore. Ice numbs it. But when we're talking about expediting healing, that's a different story.
Yeah,
Right.
absolutely.
So it's the intent, right? And I talk about the story with my daughter when she was waking up from shoulder surgery and the nurse is coming at her with an ice pack and she's barely coherent saying, I don't want to impede my healing. And I'm like, I have something else. And I'm putting FSM on instead. It's all education, right? It's explaining, yes, the frozen bag of peas feels good.
Yeah.
And Dr. Diana Cross, our cheerleader in Australia, is doing fantastic work with macrophages. And that is the premise of how these orthobiologics work. We're getting the macrophages, our body's cleanup crew, to do the repair and healing. And she's going to prove how FSM and macrophages work together. She's brilliant. We are.
I'm trying to entice her either to come in person or to do a Zoom I'm already planning next March.
Yeah, it's going to
It's
be
going to be
epic
a
because we get
thing.
to celebrate your birthday too.
I know.
It's
It's
going to
going
be
to be
like
so
a
much fun.
like a
Judith Johnson. I just attended the Phoenix Corps and I'm excited about a cat patient I had with dramatic improvement after one treatment. 16-year-old cat had a hard time breathing for 13 years, had a severe restriction in the caudal part of the nasal passages, had a CT MRI of a cat. Okay, moving on. And endoscopy of a cat at the specialist found nothing except narrowing. I wrote a program to reduce scar tissue and fibrosis, also around concussion and vagus. She can now breathe great, does not make any noise when she breathes. The owner said she now jumps up and down on things where she couldn't before in just one treatment. Woohoo!
I love the people stories, but I love the animal stories because there can't be a placebo effect with animals. They either breathe better or they don't. They move better or they don't. Wow, one treatment. That is.
That's exciting.
So now we need to have a whole FSM vet kind of cohort educational platform because
We
there's so
need,
many people that treat animals.
and we have Mary Ellen Chalmers has finally created the Institute for Functional
Mhm.
Dentistry, and FSM is part of that core curriculum.
Yeah.
And we are doing our first not public, medical presentation in Switzerland in at the end of August, just before I go to Poland. I'm going to Zurich first, thanks to Dr. Don Daniels, who finagled Mary Ellen and I both to Switzerland. And that's so we have dentistry, and we've only had, I would say, 4 or 5 veterinarians take the course. And it's just a matter of finding an avenue into that profession because horses, dogs, it's really, I told you the story about the FSM practitioner who took his blue box to the racetrack at Santa Anita. And after he'd been there 4 or 5 times, the horses that he treated would see him coming and take their position next to the wall because they knew they were going to be falling asleep.
Oh my gosh.
Yeah, it's like they, in the resonance effect, we talk about that white horse that just,
Yeah.
and these race horses would originally just lock their knees and try and stay vertical. They gave that up. They'd see the blue box, they'd see the wet towels, and they'd just move over next to the edge of the wall and get ready to just lean.
When I bring my dogs to the clinic, even if somebody's running FSM at home, they just want to be in the field. They'll jump on the couch, they'll jump on me. When I was training my shepherd to just sit and stay at the clinic, when something really good was happening on the table, she would army crawl really slowly across the room just so she could lie under the table to be in the field of something. And she didn't like people, but she just wanted to be close to whatever was happening. And again, that's not a placebo. The dog is not trying to do that to make anybody feel better. Something obviously feels really good.
Sister treats herself, and we have 2 cats,
Yeah.
and they sleep on opposite ends of the bed unless she's treating herself with FSM.
Yeah.
When she's treating herself with FSM, they both climb onto her stomach
Yeah.
next to each other.
Right.
Just want to snack on the Dorfang here. Don't mind me.
I love that snack on it. Another question. For dehydrated tissue, can we use 81 on A, 142 on B? How do we rehydrate nervous tissue? question is 81,396 question mark.
And nervous system tissue doesn't get, actually, for that matter, I'm not sure fascia gets dehydrated. It's a semiconductor, so
Right.
that's where the water lives.
Yeah.
It's it, but increasing secretions in the fascia theoretically increases ground substance. With nervous system tissue, it's a little bit different because when you look at how nerves work, when they get inflamed, they don't conduct signals, neurotransmitters normally. So first you have to reduce inflammation to take a nerve from hypersensitive to back towards normal.
Right.
But at the end, to restore motor function and if it's numb, then you have to do increased secretions in the nerve to increase the transmission of neurotransmitters.
Right.
But a nerve won't conduct neurotransmitters as well when it is inflamed.
Right.
So that's a thing.
Yeah.
So I wouldn't think of it as hydrated or dehydrated, would you?
No, I wouldn't. And
Okay.
and even if I did, again, the way we get the gold star is, okay, even if this is dehydrated, why is it dehydrated? Again, it's not just talking about scarring. I showed you a snippet from the podcast. Scar tissue doesn't come from outer space, and everybody
love that.
laughs about that, but that's a Carrollism, and that was part of. You're right. Things don't just scar. Things don't just get dehydrated. What are the events that are leading you up to that thought that something feels dehydrated? I have treated extremely dehydrated people. I'm talking about Ironman athletes after a race. I'm talking about somebody who just ran a marathon and I hooked them up to FSM. They are physiologically dehydrated. They conduct just fine.
Yep. I really have to apologize to people. The whole hydration story
Yeah.
that I had at the beginning of FSM, I think it was more a matter of me picking the wrong frequencies. And I blamed it on dehydration because I didn't have the concept yet of treating the cause.
Right.
It's just,
And
so
sure, healthy tissue, healthy hydrated tissue would for sure conduct a little bit better, probably. But like I said, I treat very dehydrated athletes and older people who are dehydrated, and they conduct just fine. I don't know.
and hydration is 4 ounces an hour
Right.
during the waking period of time. So
Yeah.
I'm going to change those slides. Sorry, Kevin. And Judith Johnson said she's the
She was
vet
the vet.
that was
Oh,
at the
great.
training.
That's why you could do all the fancy imaging.
IBD, hyperthyroid, having loads of fun. I
Yay.
want to see in horses, I think you're probably a small animal vet, as I recall, Judith, but in horses, suspensory ligament strains, they never get torn, they just get sprained. They put a horse on stall rest for 9 months, at which point the horse is completely insane and it doesn't work. And so you have these performance horses that are out of commission, and that I would like to see if we can improve athletic injuries or sports injuries in sports performance horses. That would be fun.
Yeah, sign me up for that.
Yay. Thank you, Leaf.
Thank you, Leaf. And it's 4. The alarms are going off.
Yeah, and it's 5 o'clock here in Costa Rica, and
This looks
it's
beautiful. Well,
it, yeah, I made my own vitamin D today.
good for you.
It was 85 degrees, and I sat out and read my book and climbed in the pool. And yes, you're allowed to be jealous, but I needed the rest.
Yes, you did.
I
Yes,
did.
you did. Yes. Keep enjoying it.
I'll
What
be
a
home Monday night,
okay.
and
That's
I
what
go to work on Tuesday.
yay.
in
work
Michigan.
work in quotes, right? We
Yeah,
love what we do so much.
it's, yeah.
Okay,
Otherwise,
thanks everybody. Thanks
yes.
for your Costa Rica appearance.
Thank you, Kevin, for reminding me it was Wednesday.
Yeah, yay, Kevin. And we'll see everybody here next week.
See you next week.
All right, bye.